That urgent warning about the possible dangers of plastic surgery to get a look like Kim Kardashian's. Experts say the surgery is one of the most lethal if it is not done correctly. And Diane Macedo is back and has more on that.
Thanks to celebs like Nicki Minaj and Kim Kardashian, voluptuous booties are in. But the American Society of Plastic Surgeons has a new and urgent warning about the large number of deaths they say occur during a procedure called the Brazilian butt lift. According to the society, as many as 1 in 3,000 patients die, making this potentially more dangerous than any other cosmetic surgery.
You have an increase in number of doctors who are attempting to perform this procedure. And unfortunately, a lot of these doctors are not board certified.
The Brazilian butt lift is meant to make a rear more shapely. It basically combines liposuction with fat grafting, sucking fat from where you don't want it, like the thighs or stomach, and injecting it where you do. But when performed improperly, there's a risk of a fatal fat embolism.
Some surgeons are injecting a little bit too deep. There's some important veins that bring blood from the lower aspect of the legs back into the heart, into the lungs.
29-year-old West Virginia mom Heather Meadows came to Miami for a Brazilian butt lift in 2016. She never made it out of surgery. The same happened to 40-year-old Kizzy London in 2017, also in Miami.
Patients should look for a plastic surgeon who's board certified by the American Board of Plastic Surgery.
And Dr. Jen Ashton is going to join us to talk. This is extremely serious.
Right. This is a big deal, Robin, so I want to put this into context with you. This is the actual warning that came out this week from 5 international plastic surgery societies. They title it an urgent warning. We spoke to a plastic surgeon this week who said a warning like this is unprecedented. They are considering even banning the procedure because the risk of intraoperative death, this means death on the table, is so high. And to put that into context for you, we heard in the piece 1 in 3,000. There have been studies done for elective plastic surgical procedures that look at over 1 million patients. The risk of dying on the table is 0. This procedure is more common, more popular. It's up 10% in just the last year. So this is a big deal.
Can you help us understand why this is the case?
Yeah, so let's do a little mini anatomy lesson here, Robin. If you look at the anatomy on the glutes, in the buttocks, we think of it in terms of layers. You have the skin, then you have the subcutaneous tissue there in yellow. That's where the fat should be going. Then you have a very thin layer called fascia. And below that, that is the danger zone, Robin. You have muscles, you have veins feeding those muscles. This is a procedure that's largely done blindly. So if the surgeon penetrates that fascial layer and gets the cannula into that deeper layer, fat goes into veins. Veins then travel to the heart and the lungs, and you can die on the table.
That helps you really understand that. So, you know, there are going to be some people who are going to want to take the risk. What do you suggest?
So this is something, the onus of responsibility has to be on the surgeon to counsel that there is a higher risk of death in this procedure. Patients need to do the following things. Absolutely go to a board-certified plastic surgeon. They do need to consider alternative procedures and techniques. There's something new called electromagnetic sculpting that is non-invasive, that can kind of stimulate the muscles. And then good old exercise, Robin. Just do those squats, drop it like it's hot, and keep it down and build those glutes.
What is the one that Chloe...
That is my medical advice.
No, but Chloe has this new squat. Remember, your daughter
That's right, split squats.
Yeah.
We'll demonstrate that on Instagram.
Oh, okay. You're on. But thank you for that, Jen. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.